so now I'm going to talk about a few special populations and the modifications you need to do when prescribing exercise to these people. So the first one I'm going to talk about is hypertension. So hypertension is chronic elevated blood pressure in the arteries, okay? And things you have to consider about this, like you can't perform exercises with the feet are above the head. Also, if the hands are above the head, because that is just putting a lot of pressure on the heart. Additionally, things where you hold breath, like if you're using like a Valsalva maneuver, like you're creating intra-abdominal pressure during a lift, that would not be appropriate for this population. Also, like rapid posture changes, so like you've got to, perhaps exercises like burpees would not be appropriate, or where you're hanging upside down. So that's about it for hypertension. Now the next one I'm going to consider is lower back pain. So lower back pain is either like muscular or skeletal associated pain, or sometimes without a known cause, to the lower back region, often the L4 or 5 discs, where the pain is located. So in that situation, what you've got to do is minimise spinal loading. So exercises such as squats and deadlifts, also bent over rows should be avoided. Also stuff like overhead presses. When you overhead press, you can have too much of an arch in the lower back, which can put a bit of pressure on those vertebrae. So you're just going to find exercises which don't load the spine, or variations which are better, so don't load the spine as much. For instance, you could do more one-legged exercises like lunges instead of squats, or things of that nature. Or seated, you could use like seating support, for instance, like instead of bent over rows, you could have a chest supported row, so you have a pad and like this to support your back. That's just a few examples of how you can modify it. The last one I'm going to talk about is shoulders. Now the shoulder is a very mobile joint, actually the most mobile in the body, but that makes it unstable, so it is quite prone to injury. So things to avoid are lat pull downs. They can cause some impingement in the shoulder, which you want to avoid. Also, bench pressing through a full range of motion can tend to injure the shoulder. So there's alternatives for that. Also, shrugs can cause impingement in the shoulder, and upright rows. So with these exercises, you need to make modifications for some of the shoulder pain. So something like a neutral grip pull down like this will be more appropriate, and put less strain on the shoulder. Also, same with presses in a neutral plane will be better. And also upright rows, if you want to do them, you can reduce the range of motion, so don't come up as far, and move the grip in as well. So that can help out a lot. Okay, well that concludes my special population speech.